When you are starting in AccuGuide with the chart of the patient, you see that you can set up a certain number of procedures, of works, of diagnosis. And I'm going to explain to you how we can manage all these things and how we can implement new procedures and new diagnosis. So for that, the first thing to do is to go to settings on the upper left side. You click on procedures, and I am going to show you all the list of procedures that we have. Some procedures are active and some procedures are not active because we don't use them. So you will select what you want to be active and not active. By the way, we have a certain number of families: amalgam, anesthesia, chart, dentistry, and you will select inside these families what you want to use or what you don't want to use. So let's start with something like an X-ray. So you have X-ray, it's a film periapical. This is the code D0220. And when you click on this, you have the details of what is included inside a procedure. A lot of things are included inside. I am going to explain to you all that. First of all, you have the icon. If you want to load your own icon, you can choose a file and load your icon. The icon size will be 35 pixels by 35 pixels. The practitioner code is this, so it's AAK in this case, Arshad Alam Khan, and number 35. This number is given by the AccuDent. You cannot change that. So this is what this means, that this procedure is attached at this price and with these details to this practitioner, because each practitioner in the same clinic can have different fees. The family is in X-rays. The nomenclature is the name of the procedure. We call that periapical film. It is the first one. The code is D0220. The procedure is care. It can be care, it can be implantology, it can be prosthesis. We select care. This is linked to the requirement of some kind of insurance where they divide the care, the implant, and the prosthesis. The analytical is the list of all the things that you need to refer when you are working on statistics. So for that, we have a selection in that for statistics, and for statistics, we don't have X-rays in statistics, so we have nothing. It is just select. The traceability is for all what you put in the patient's mouth. You need to have a tracking number of the lot, and we can add this for all the products you use here, or you can add it one by one at the time you use it. We will go into details with that. This is called the traceability. The category, you have three categories: diagnosis, procedure, and work. So in this case, doing that is a procedure. A procedure is something that you perform and you ask for a fee for that. In some cases, you find that there is a diagnosis, so you put a diagnosis and there is no fee for a diagnosis. But if you need to implement while you've been doing a cleaning, for example, for an insurance, at the same time, you need to tell about the diagnosis. It was an acute gingivitis, for example. And what about work? Work are all these things that you do, but you don't charge for that specifically. For example, you are making an impression, alginate impression, or you are doing a cementation. It's a work. This means that you are doing something, but there is no specific price for that. Like, for example, anesthesia, okay? So these are kinds of work. They are not diagnosis, they are not procedures, they are work. And the work will not come into an invoice, for example. So in this case, we take a periapical film. It's a procedure, and this is the full name, the description of all the code, which is this one. Now, you have three options to work. You can work on one tooth. I take an X-ray on one tooth. In this case, I work on adult one, and this is the price. the statistics specialty. So we have a certain number of statistics specialty. This is coming from NABID, and we have to implement what kind of statistics specialty it is based on what we need to refer. It's NABID or DHA for 37, 38, and 39 statistics. Sorry for that. The status is active or inactive, and you can change it as you want. So let me go back to the procedure. You have three kinds of procedure. The first one is one. So I take an X-ray on one tooth, it is one. The second option is a global procedure. I give you an example of global procedure. It's a consultation. You make a double click on the consultation and you apply the consultation. It's not referring to one tooth. It is a global act, okay? In some cases is one area. One area, it can be on the full upper or full lower. For example, I take an alginate impression on the upper or on the lower. Or I do a Perio surgery on the upper left side, and you will have to select what kind of area is linked to your procedure. And you have the multi-teeth. The multi-teeth is linked, for example, to the dentures. And at the dentures, you can select 1, 2, 3, 5 teeth in different positions, and then all of them are selected. You click enter, and you will have in one line all the teeth included inside the denture. About the price, you have a certain number of ways to enter the price, adult or child, or all linked to any kind of insurance you have. Because if you are in a network, you will work with the price of the insurance. The price of the insurance will come into copay here. The price of the patient's fees is here. And the total is the sum of copay plus patient's fees. You can work also on child. Let's say you do an extraction on child, it will be cheaper than the same extraction on a patient, on a grown-up patient. So, and when you've been doing all that, you can save it. So it's very important to start with that. You start making your price list, okay? You save. I am going to show you another example. An example in for example, diagnosis. Diagnosis is a consultation. I have a consultation here. I have the consultation adult 300, and that's it, okay? So I have some kind of different things, like I go to an implant. Implant is one. I check on implant. Implant for one implant. This is the price for one implant, and it will be done one by one. Let's check about the removable. On the removable, we are not dealing with one tooth. We can be dealing with one tooth. I check on a removable on the upper. And here you have for one tooth, 2 teeth, 3 teeth, 4 teeth. The price is changing every time. So if you select 7 teeth, the price will be 800. If you select 1 tooth, the price will be 200. If you are working, this is with adult, if you are working with a company or you are linked with a company, let's say Bupa, okay, at that time, you will add a new price with Bupa. I check Bupa, okay, and Bupa will be the new price for 1 tooth, and this will be the price for Bupa, for example. Okay, doing that, when the patient is linked to Bupa insurance, automatically the price will come like this for one denture of 1 tooth, 1 tooth on 1 denture. If he has more, you will change the price, but the price for Bupa will be different from the price from patients who is not insured in the Bupa network, and it will recognize as just an adult patient. Okay, so I remove that. I don't want to keep it. It was just to show you, and I can save it. In some cases like this, it's a full removable denture. So by default, it is 14 teeth. So I select all the 14 teeth and it comes in one price. So no need to do 1, 2, 3, 4, 14 teeth in one time. So we've been simplifying all that to make it faster and easier for you. Let's go to Perio. If we go to Perio by quadrant like this, gingival flap procedure. So by quadrant, it will cost 800. It's one area, and I'm going to show you how it is working. So I go to a list of patients, I click on Angela, and now I am going to show you what I did. I have been making a price list. I have been working on the different way to enter a filling for a procedure, and we are going to do it together. So let's go to implant. I am going to select one implant, and I'm going to place one implant. Okay, and now I have the implant placed. This is the implant. You have the implant name here also, and you have the price and everything. If you want to change it, you just double click on that, and you can change the price, and you can make comments, and you can here scan the QR code, which is printed on the box of the implant, to get the traceability of the implant. So I save that. I'm going to show you another one. I am going to work on removable. So on removable, I take a denture. The denture will be on these two teeth. So when I've been selecting all the teeth, then I can apply select. And here I click here, and I have the price for the tooth number 2627. It's a partial denture, and this is the price of the denture. So all the calculation is done in one time. So let's go to Perio. Perio, we are going to go to a gingival flap procedure per quadrant. So if we work on the upper right side, left side, or in the upper front teeth, I click here, and I have the case done on the upper front gingival flap procedure, and this is the price with all the details of the price for patient, the price for copay insurance, and the total price. So and let me finish with one price which will be diagnosis price. I do a consultation or an OPG, double click. I click 2 times, and I have the OPG which is coming. This is a global procedure. In some cases, I need to add some different things like the semiology, and I need to write that I have a mesial here, mesial decay, okay? And doing that, if I can do a procedure like a filling on a mesial filling, I do this and this, and I make the mesial filling, which is covering the diagnosis. So in this case, we have a diagnosis and a procedure. I am going to go to an insurance form, and some insurance form, let's say it now we have here, okay? We need to write what is the diagnosis. The diagnosis is mesio-occlusal dental caries in dentine on 32, on 33, and this is the treatment which has been done with the detail of the treatment, mesial anterior composite. And at the bottom, you have the invoice, which is edited in another way also for the same patient. So we can save that, and we can do it. We post it. So this is posted now. So the patient needs to pay that, and we can print it and give to the patient, or we can keep it like this, and it will be sent attached to a document. And I'm going to show that to you, to the patient. So I click here, I close all that. And now in the history, we will be able to find in the history, we will be able to find the invoice which has been done. So this is the claim form. If I click on the claim form, I see what I have been doing here. I have been doing 2 fillings, so it's okay. So I go to the patient, I go to the email, and instead of printing a lot of things, and patients are going to be able to forward that directly to the insurance. So it's a big service you give to the patient. So I go here, I send these documents attached to the email. I click on documents, and I have the documents deleted, the forms and the claim form. And this is the last claim form with the VAT, with the number of the invoice, which is edited here. All the invoices are edited following a chronological system on all the clinic. It's not based for a practitioner, it's based on all the clinic. And then you have that, and then you can send it to the patient. The patient receives that, The patient has everything he needs, and you've been printing nothing. It's all clean and nice. So if we go back to the patient, if we go to the history, you have all what you can send in the history, okay? So when you have a claim form like this and you've been making a mistake, okay? So you go here and you can click here and you can then void the claim form. You cannot delete the claim form because there is a number of the claim which is attached to this claim form. So you just void it. And then in the reports, when you will go to the VAT, so you click here and you will see all the invoices that you can sort in chronological order. This is the number 1, number 2, number 3, number 4, etc. And you know which have been void and which are posted. So you give that to the accountant and everything is very simple to verify because you go to the patient's file, you click on the patient's file and you go to history and you will find the files with the numbers and the void numbers which are appearing here. So this is the way it works, and this is the way you should implement that. So let's go back to the settings. We've seen the procedure. We're going to see the My Procedures, and this needs to be customized for each of you. So by default, everyone will receive the AccuDent selection. On that side, on this side, you have all the procedures, and on this side, you have your own sort of procedures. So let's say if you do amalgams, you click on amalgams, you have all these things which are linked to amalgam. So this is not you. You are there, and Dr. Arshad made a selection. On Arshad selection, it is not on the same selection as AccuDent. So you have the chart, you have the semio, you have the fillings, you have the endo, the root canal, you have all what you need based on what you do. Okay, so how to implement a fix? So you go to the fixed prosthesis, F, X, A, and here you have all things which are fixed. Let's say I'm doing an inlay metal MO. I click here and I put it in that list. Okay, I put it an inlay which is occlusal inlay, a distal inlay, and MO inlay. And if you are doing that, automatically you will work on metal inlays for your patients and you clean and do the act. If you want to remove it, I'm going to remove it because I don't want to do that. Okay, I remove it and I save. Okay, if you want to add a new tab, for example, you're working on kids, you add a new tab, you call it Perio, and in Perio you are going to click and drag all what you are doing in the patients. So knowing that, you can start working in a good way on the patients, because now you have all what you need to work on the patient's file with this, which is the chart, which is available to update all these things.